So plantar fasciitis is a very common condition marked by extreme heel pain, especially in the morning times when getting out of bed and taking those first couple steps. Sometimes the pain can decrease throughout the day, sometimes it can get worse. It really depends. But I want to point out 3 important factors that you should know. Number 1, plantar fasciitis is often aggravated by inflammatory proteins. So if you're drinking or eating a lot of dairy products, for example, a lot of the dairy protein will cause inflammation in the heel, also gluten as well. You want to keep that in mind. Secondly, you want to consider the type of footwear that you have, as well as the arches of your feet. If your arches are compromised, that can affect the way pressure is placed on the heel, and then also the kind of footwear you're wearing, whether it's a really flat shoe or a really flexible shoe. All of these factors can affect the way pressure is put on the heel over time. Thirdly, you want to consider the joints of the foot, of the heel, of the shin, of the knee, of the hip, of the pelvis, of the low back, all along the body, all along the chain. And you also want to consider how the muscles in the fascia of the foot and the leg and the knee and the hip and the body are affecting everything below. Because if there is a misalignment or a malfunction of the joint anywhere in the hip, the knee, the foot, or if there is a buildup of scar tissue throughout the foot or the leg or the knee or the hip or the back, all of these areas can affect the heel and cause chronic plantar fasciitis. So the goal would be to clean up the diet, check out the type of footwear you have as well as the arches of your feet, and then get your joints, muscles, and fascia properly evaluated to find the root cause of pain that has been bothering you for so long. Know the causes, but also know the solutions as well.